All right, thanks, Dan. Well, more than 1 million people a year in the U.S. will get pneumonia, and some of them will die from it. That's why one Utah hospital is working to improve the way doctors diagnose and treat patients with a severe lung infection. Here to explain, Dr. Nathan Dean and Dr. Peter Haug with Intermountain Medical Center. Thank you both for being here today.
Thank you for the invitation.
Well, people, I'm sure, have heard of pneumonia. A lot of us have probably had it in our past. What actually is pneumonia, and how do you know if you have it?
So pneumonia is an infection of the lung tissue with either bacteria or viruses most commonly, and we get it by inhaling or aspirating into our lungs bacteria. It's often in smokers, diabetics, but often just following a viral infection. Just about anybody can get pneumonia, and it's the most serious infection that remains in developed countries.
And it seems like it's something with a lot of other illnesses where you need to treat this quickly before it develops and get worse. How important how important is that early detection, screening, and finding it soon enough?
Well, patients have to come in and have enough symptoms to the point that they seek attention from the doctor or the emergency department. We designed our tool for the emergency department because it's where the sicker patients are, and we have the ability to use the computer to help the physicians with diagnosis and decision-making on how best to treat the patients.
And Dr. Haug, that's where you come in. When you talk about computerizing the medicine, that early detection, what has your research shown you?
What we've discovered is that the tools we provide do help recognize pneumonia a little earlier, but probably more importantly help standardize the way people approach pneumonia once it's recognized. Standardization of care along guidelines that are supported by good science and good evidence is a very important part of good care.
And I often hear the term best practices when speaking to doctors at Intermountain Medical Center. Is that part of using this system so you have the best practices when treating for pneumonia?
Intermountain Healthcare is very committed to achieving best practices, and we are constantly looking for tools and ways to improve our ability to deliver on that goal. This is one of a variety of tools that we have that many of which involve the computer that help with that.
Now, as a patient, I'm walking in, I feel horribly. I just want some help. How does this new tool help me in my care?
So it's not visible to the patient. It's really for the physicians and somewhat the nurses. And what it does is it assembles all of the data, calculates severity scores, and provides information so that the physician can make the best decision, first in terms of whether you have pneumonia or just bronchitis, then whether you should go to the intensive care unit because you're super sick, or hospital ward, or can be safely treated at home. It recommends specific antibiotics. And of course, doctors can make this decision on their own, but our previous research has shown that doctors vary a lot. They're not the same, and they're not all by the guideline if they have to figure these things all out, because the computer can have 40 or 50 elements that it puts together. Doctors, just like anybody else, can only think of about 3 to 5 factors at a time when we're making decisions.
And the computer can do so much more in helping you do your job better and helping me or us, the patient. Well, Dr. Dean, Dr. Haug, thank you so much for joining us today.
Thank you.
Thank you.
We'll put those details on our website at goodforutah.com. You can see it there on Intermountain Medical Center. We'll link you up to that on our website. Up next, couples are